One of the big things that I've seen and learned is that a lot of the money, of course, Arkansas, when you're dealing with our budget, you got three main factors. Our biggest revenue source is, of course, agriculture. And everybody talks about the fact that our second biggest is tourism. That's where all of our money comes in. That's where our budget comes from, everything else. Everybody wants to overlook the fact that our literal second largest income and revenue stream is federal assistance. So the money that we're allocating at the federal level that gets sent down here to the state, that's the second biggest revenue source we've got. And a lot of times when that money's coming in earmarked for something, it hits the administrative level here at the state and it suddenly starts getting reallocated and redispersed to completely different projects. That's one of the things that I've got a problem with, because when you talk about the maternal mortality rate, I just saw numbers on it. I'd have to look it back up again. But we've got right now, I want to say we're sitting at right at half of our state is sitting at a healthcare desert level for OBGYN services. The hospitals simply do not have them on staff. They don't have it anywhere. The majority of women, if they have an emergency where they need some kind of care, during pregnancy or for delivery, they're having to travel a half hour, an hour away to get somewhere where they can get those services, just because the majority of hospitals don't have it. And the fact, this gets me all the time, the fact that they want to sit there and brag and call us, quote unquote, the most pro-life state, while having that as an actual fact of life here, it's unconscionable. It's just flat out unreasonable. So having them pulling money away from Medicaid and having them put in work restrictions and having them put in all these different things that make it even more difficult for women and children to get the health care they need, the neonatal care, the follow-up, the postpartum care, all of that. It's just unreal. It is absolutely unreal to me. For me, at least at the federal level, one of the major things would be making sure that money that is earmarked for healthcare purposes, for health and human services, it's making sure that that's actually getting to the people that need it. Because I got to be honest, I don't even know that they're collecting data on what the major drivers behind the maternal mortality rates are. They simply take it as one lump thing, where it's okay. What's going on here? What are we dealing with? Are we bleeding out? Are we dealing with people who are wrestling with addictions, alcohol syndrome? What's going on? And just trying to get that information to know what the underlying drivers are is just an uphill battle.